Hi, this is Pam Taylor. I am here today to talk to you about the 10 elements of agency ownership. Thanks so much for showing up. And again, this is Pam the Nurse, CEO and owner of North Star Medical Consulting, where we help others to plan, launch, and optimize their own private duty home care and home infusion therapy services program. So thanks so much for tuning in. You're in the right place if you're considering starting a private duty nursing practice or maybe a home care practice, if you want to get into home infusion therapy services, or maybe provide some kind of concierge services, or we work a lot with these kind of niche services, these home niche services, concierge. My goal for you today is to get some clarity on your business goals and what your next steps are. Do you really want to do this? What does it look like? What are the different essential components of starting an agency? And if you want to move forward, what's next? What are your options? Questions you should be asking yourself is, what's the difference in the different agency models? And do you need to be licensed or accredited? And what services should you be offering? What kind of systems are you going to need? And the essential aspects of agency ownership and what kind of resources, what options are available to start your agency. So we got a lot to talk about. So let's get going. Let me know in the chat if you have any questions or shares. Just back channel that. And when we get to the end, we will take those. So hopefully you all received the workbook. The replay and workbook are available if you need them. I will be sending a replay to anyone that has registered for the program. I know everyone's on a different time schedule. And the workbook, you can always go to homehealthacademy.teachable.com and get that free download. So Home Health Academy at teachable.com, you are able to get the workbook that goes along with this. And it's really helpful when you're planning your next step. So let me start by telling you a story. My name is Pamela Taylor, also known as Pam the Nurse. I am a registered nurse, and I have been a nurse for 25 years. And I was working in the hospital. I started in telemetry, floated all over the place in that. It was a county hospital. It was a teaching hospital. It was just a great time of learning. I ended up in the trauma unit, super loved it until I just didn't anymore. And I got kind of burnt out. So I thought, what's next? And I just took a big dive. My kids were grown. They were leaving the home. My last one was turning 18. And I thought, I've always wanted to live at the beach. So I moved to the coast, took a job in home health. And oh my God, I loved it. I love home health. I love everything about home health. I love the clinical piece. I love the administrative piece. I love the ownership piece. I love working with nurses and others to launch their own agency. And that's what I am now. I'm an accredited consultant. I'm a life coach. I'm a certified continuing education provider for the Board of Nursing. And yeah, it's what I do. It's my jam. I'm also a life coach. So, and here I am now, just happy as a clam. So hard work pays off. You know, getting into and launching your own agency is keeping your own money. It's owning your practice. It is creating your own wealth, creating your own legacy. And that's what I've been able to do. But it has been hard work. I've had to be boots on the ground. I've had to go in and do the clinical work. I've had to create policy and procedure. I've created programs and teams. I've done the marketing, the licensing. I've helped build and sell for agencies, and I've done super, super well with it. And I just want to pass it on. It's kind of like my gift to nurses. So that's kind of what I do, my goals, my mission. So let's talk quickly about home care versus private duty. If you're considering starting a home care agency or a private duty agency, you can do them both. Home care is essentially, when you're talking about home care, you're talking about clients. When you're talking about private duty nursing, you're talking about patients. Usually private duty nursing, well, always, if you're going to do nursing on a private duty patient, it's going to require an order from a doctor or a provider, nurse practitioner, PA. Where home care, that's elective. That has nothing to do with the physician. You are in there maybe providing transportation or doing light housekeeping or things like this, companionship care. So you can have a home care portion to your agency and a private duty portion to your agency. You can do both of them. I can show you how, but that is the difference essentially in those two models. Concierge services, nurses, nurse practitioners, PAs are doing great in this model. Physicians are doing concierge, where they're actually going into the patient's home and providing care. And this is a great service. You can do it one of two ways. You can do a concierge service all on your own, hang your own shingle. Just make for sure that you are following your state board's recommendations and requirements, and you are looking at what your state says, if that's legal or not, and that you are getting insured properly, and that your insurance agency understands what services you are providing in the home, and you're not doing that with a actual license, a home care private duty license. You're doing that all on your own. So you can also, a lot of concierge people are going for a private duty nursing license, and they're able to bill out insurances and do some other things, work with pharmaceutical companies and things like that. So just know that those two options, and licensed or accredited. Licensing is to become a private duty is through your state. Some states just require an application and registration, but the licensing happens and then the accreditation comes afterwards. So typically you'll get licensed in your state. You'll see 3 or 4 or 5, however many patients you want to see, but your accrediting agency, which is Joint Commission or CHAPS or ACHC, comes out and looks at 3 of your patients and actually does a survey. So that's some of what I do. I help people get licensed and accredited, build their business plans and all of that, but we'll get to that in a minute. So in my travels as a nurse, what I have learned, in order to thrive and make it in business, you need to get super, super clear on your purpose. Like, what are you doing? What is your business model? It can change. You'll want it to change based on what's happening out there in the world, but you need to get super clear on your purpose, your model, get organized, get resourced, and then believe in yourself and share, share, share. That's the marketing portion of it. And these 4 things, these are kind of my motto that I live by, I teach by, and I share in my Blueprint to Success program, which you're going to hear about later. So clear purpose. This is really your work. Why did you become a nurse? Why did you become a provider? Why do you love giving care to people? What about it do you love? Get real clear with that. Some people love the hospitality end of it, and you'll see them in the hospitals as nurses or CNAs or home health aides. They just love tucking patients in, making for sure they're clean and dry, well fed, that their environment is beautiful. Maybe that's your purpose. Maybe that's what you love, is making the world a better place for people. Maybe you love wounds, watching wounds heal. Maybe you love doing infusions. Maybe you love high critical patients. Maybe you love diabetes teaching. Maybe you love coaching and weight loss. And maybe you love, it could be anything. For myself, I thought I always wanted to do pediatrics. When I hit nursing, holy guacamole, and I have fallen in love with the geriatric population. So I just love old people. They're smart, they're wise, and I'm soon going to be one of them. So figure out your purpose. This is your own work. Business models. What do you want to provide? Do you want to provide skilled services? Do you want to send nurses out to see patients? If you get a private duty nursing license, you could even send occupational therapists or physical therapists, registered dietitians, social workers. Do you want to do skilled services? Do you want to do non-skilled? Do you want to do that plus you want to do some kind of home care model? You can do them both. Do you want to, who are your payer sources? Are you going to go for private pay? Do you want to bill out insurances? Do you want to bill out Medicare, Medicaid? These are the things that you need to consider. This is something that you need to get super clear on and establish goals around that. That is part of your business plan and part of what we do in Blueprint to Success. And then finally, when you have this clarity, you've got your purpose, you know your business model, and you're sharing it. You've got to believe in yourself. Wherever you are, whatever you're doing, you're getting your hair done, you're seeing your attorney, you're getting your taxes done, you're getting your car washed, you are marketing, marketing, marketing. You are now the face of your company. So marketing is just such a huge part of this ownership model. You need to really believe in yourself and believe in your product and take ownership for it. So those are the things, the little nuggets I want to share with you and my philosophy and kind of what drives me in agency ownership and consulting. So get organized and resourced. How do you do that? There's different ways to do it, and I'm going to go through them as quickly as I possibly can. But there's the franchise model, and a lot of people do this franchise model, and you buy into it. You buy a franchise, and you will get a certain territory. You'll apply for like zip codes. So you'll get, or maybe you'll have a county or a city, or they sell territories. You will stay within your territory. You will pay probably somewhere between $65 and $150,000, $300,000, $65,000 to $350,000. I mean, it depends on the size of the franchise. So it's pretty spendy buy-in. And then you will also be giving a royalty fee. So you'll give a percentage of your gross to that franchise model forever and ever. There will be a minimum requirement that you have to meet, say maybe $1 million gross in 5 years, which is completely doable. 200,000 gross a year by a private duty is completely doable. But if you don't make it, you still owe that money back to them. That royalty, you have a huge balloon payment. If you haven't made it, you will still have to make that big balloon payment to them. And if you can't, then most people just give the agency back. If you want to grow within that franchise model, you will need to purchase another territory. So the franchise model offers branding, it offers the software, it offers the marketing, it offers consulting. So you do get those things with it. It is a high price. You get to start off with training wheels, which is pretty great. The drawback is when you no longer want those training wheels, they don't fall off. You are in that franchise model forever. So another really popular thing is membership groups. And that is where you are paying someone a certain amount and they are providing you with maybe software, maybe branding, maybe marketing, maybe consulting. So each membership is a little bit different. Some memberships are educational purposes. You're able to train your staff at a certain amount per month. And I do offer some of these things after you're up and running. So, and I'm not out to make $1 zillion. So if you consider a membership after you're up and running, yeah, hit me up. Consultant, you can just hire a consultant. I'm going to give you some key things to think about when you're hiring a consultant. What background does that consultant have? A background that has some clinical experience, that has started their own agencies, has been the director of patient care services, has been the supervisor, has been the administrator, has been marketer, the person that has kept the lights on, that has succeeded. Look for those qualities when you're looking for a consultant. You want someone with a total bird's eye view. You don't want somebody that has just done supervisory or has just done, a lot of times consultants will be surveyors from like Joint Commission or ACHC. That's great. They can get you through survey. However, they don't know the ins and outs of running the business. That how do you make money at it? Not just how do you pass the survey. So really, if you're going to hire a consultant, they go anywhere. Anywhere $12,500 for a home care consultant, which you're going to get some one-on-one with them, to $35,000. For a consultant that's doing like an accredited home health agency. That's how much you're going to pay for a one-on-one consultant. And I'll tell you, this is the business model that I had. That's what I charged and that's what I got routinely. And I loved doing the work. And then COVID hit. And so I built my Blueprint to Success program. So it's kind of spread it to the masses. Now, your last option is just to wing it. And I'll tell you, I winged it, but I had a huge background in home health. I had done everything, taken out the trash. I had done everything and I felt super confident in it. It was still very incredibly time consuming, huge learning curve. But I have built them from the ground up, but I completely know what I'm doing. And if you're in that position, go for it. And just surround yourself with tribe and do all the education and learning that you possibly can. My recommendation to you is kind of dependent on where you are in life, how much oversight you need, and where you are, how much you already know. But always surround yourself with smart people. So I'm saying consultant for most. So, and this is what I want to talk about. It's what I'm super excited about. I built Blueprint for Success when COVID hit, because as a consultant, I couldn't travel around the world anymore. It's been kind of sad. Actually, I have put on a few pounds and spent a lot of time on the beach and with my dogs. And I thought, my husband always said, hey, why don't you write a book? And so I have all of these things that I have, and all of these things I've procured, all these systems, processes, policies. I have all of this, and I'm like, hey, I'm kind of stuck here at home. I'm going to create a course. And I did. And it's my Blueprint for Success. It is an online course with a zillion downloadables. I do a consulting piece to it, and I also do a weekly masterclass. And so I've helped people all over the country to launch agencies. It's going really, really well. I love it. And yeah. So let's go back to the key aspects of agency ownership. That is the title of this program. And I just want to talk about the different facets of owning an agency and running an agency. It's not just branding. There's a lot to it. And I'm also going to be shamelessly plugging how I handle it in my program. So module 1, your business model. Like, this is where you get super, super clear what services, what your competition looks like, what is missing in your spectrum, your arena, your neighborhood. And it's really a great time. In my module, we talk about really nailing down who you're going after. We really nail down your avatar of the person you're going to serve. Are you going for the super affluent aesthetic patient? Are you going for maybe a weight loss patient that doesn't want to leave the home? Are you going for a psychiatric patient? Are you going for wound care? Are you going for pediatric? You know, we look at there's some people that build around lactation, around newborns, around pediatrics. I mean, that is where we're going back to our purpose. We're looking at who we love to serve. We look at what is offered in your community right now and what's missing. Where can you fit in? Where can you provide services, make a buck? And so getting super clear on business model. Number 2 is your legal entity, and this is superbly important. We have worked hard to be where we are in life, and we want to protect ourselves. So what kind of licensing do you need? What kind of accreditation do you need? What kind of certifications, or what kind of insurance? What kind of business entity, as far as incorporation, do you need to keep yourself safe? And how do you, there's this strategy of keeping things separate, not commingling. And it's very, very important for you to understand that so you can sleep at night. So, if you have contractors versus employees, how do you do that safely and securely where you can't be sued at a later date? So getting that legal entity nailed down, super important. Business name, super important. We go through all that sort of thing. Your marketing plan. Yay, this is my fave. This is where we're talking about how to brand yourself. What colors, your logo, your branding, your social media marketing. Are you going to do LinkedIn, Instagram, Facebook? We'll set pages up. We will talk about website. I don't do a website, but I'm going to tell you what you need for a website. You don't need a $1 zillion website. I do have some referral people that actually, her name's Jennifer Shipman, who's amazing at building websites. But you're going to want to build a website with a job board on it where you can post jobs. We talk about all of that. We talk about how to do your Facebook, organic Facebook and organic Instagram, and also paid. And then one-to-one marketing, super essential. And this is where we talk about a lot. Marketing is a big piece of this. So understanding your marketing is super important, and how your referral sources, who you're going to target. There are some game rules of how many times you show up. Now with the COVID, things are changed. So we have a lot to say in the marketing portion of it. So super important, knowing your budget. Yeah, how much money are you making every time you take on a client? This is really important to know. Are you making money, losing money, breaking even? When you hire someone, you're paying them a certain amount of money. How much do you need to be charging? You need to know your net profit. You need to set those numbers, and you need to set your fee schedule accordingly. So we really go through that and go through, I've got a tool that I use where you can plug numbers in and you can create a fee schedule that works. And yeah, that's what we do. And we figure out how much you should be spending, how much you should be charging, and how much you should be paying. And then look at the budgets. There's about 4 or 5 different kind of reports and numbers you need to be looking at, be consistent with. Then there's just kind of this knowing that you'll get about it after being around it for a while. Documentation, oh my gosh, all of our favorites. We talk about documentation, what is required in Blueprint to Success. My systems are all set up where you're able to customize them for yourself, drop your logo on there, drop your name in there. And, I've got 100 logs, forms, things like that you will need to run your agency. So we talk about software. A lot of people are opting for software. I love software for electronic medical record charting. I do love software, and I recommend software if you're going to get of any size at all. It's going to save you $1 zillion, and you're going to make a lot more money, and you're just going to get way more consistent. So we go into the documentation portion. Whatever you choose for your documentation, you can go online. You can order your own documentation forms that are pre-made. You can make up your own forms, or you could go with a consultant is hopefully going to have that sort of stuff for you. Building a team. So are you working alone? That can be done. Some people do it. I've seen a lot of aesthetic nurses that are going in there and taking over on a patient after they have like breast augmentation or rhinoplasty or something like that. And they're doing it all. They're wearing all these hats. They're doing the marketing, they're doing the billing, they're doing the visits, they're doing, the consulting, they're doing the whole shebang. And it's a lot of work. I don't know when they sleep, but I have lived that lifestyle. I know what it looks like. You are probably going to want to build a team. You're probably going to want to hire other people to do clinical work, and you'll want to hire someone that is kind of your right-hand man. And you might want to hire home health aides or CNAs or LVNs, RNs, nurse practitioners. I don't know what your business model is, but you're going to need job descriptions. You're going to need an interview process, and you need to know how to orient and train, and you need skills checklists and tons of HR paperwork. That's just part of running a business and having a team. Or you may be saying, I just want to do contractors. I don't want any of that mess. Then you need contracts. So when you're building a team, you need to know all of this stuff. Of course, we're going back to the legality of things. There's a workers' comp to consider. There's, all of these things take a huge learning curve. So when you're doing this, make for sure that you're getting the big picture. So that's why I love consulting. And, that's why franchisors are here. And that's why group membership is here. The 7th, and this should be 7, of training your team is once you get this team, like, how are you evaluating them? How are you keeping them up to date? How are you doing your meetings? How are you doing competencies? Like, say you're doing home infusion therapy services. Don't you want some skills checklists to make for sure that someone knows how to do a peripheral, or knows how to do the PICC line dressing change, or knows how to do IVIG subcutaneously? How are you going to train your team? You need to have oversight on that depending on what you're going to do. Maybe you're going for the home care piece. How are you going to train those people to make for sure that they're doing a good job? They're showing up timely. They're wearing their badges. They're wearing their uniforms are clean, pressed. You're not smoking. You're not on your cell phone. That sort of stuff. I have built an employee handbook that covers all of that. Employees sign for it. And there's basically an agreement created. So that's the seventh aspect of running your agency. The bigger you get, the bigger that grows. You want systems in place so you're not running yourself crazy. So quality assurance, and that's a dirty word for a lot of people, just don't love QI or QA. And I used to go, oh my God, please, no, not QA. But as a business owner, I'm like, okay, I see it. I get it. It totally affects your bottom line. You get to watch whatever you want to watch. And so the things I look for in QA is money and value. So how is the customer experience? How is the employee experience? How is my vendor experience? And am I getting paid timely? Am I making money? Is billing, taking way too long? I look at those processes and I'll do 3 at any given time, 3 numbers I'm looking at any given time. It's easy to set up. It's really, you don't have to make a big deal about it. Don't do it just to dot I's and cross T's. Like, really look at the value of the services that you're providing. It's important just not to be driving around blindly. So, I do have this is in my module, and I teach you about QA, and I give you perspective on QA. I give you forms, and I give you projects, and that you can adopt later as your agency grows. And I'll tell you my blueprint to success, how to start your own private duty home care hits, whatever. That blueprint to success, I didn't build it just to get you through agency certification or through licensing or just to get you launched. I built it for you to use as you grow. That is my intention for my program, is to plan, launch, and optimize. So, just getting the basics down, you can come back to my blueprint to success and grow with it as your agency grows, as your needs change. I didn't build it like how to start home care for dummies. I didn't build it like that. I built it as, here's the basics of agency startup, and get these basics, gotta haves, and then build to this. There's always a plan to grow and build and optimize. It's built in. And resources. So part of running a successful agency is just being resourced. You want to have binders, you want to have files and folders, you want to be able to find things. You need to know where to find things. Your employees need to know where to find things. You'll want resource materials, you'll want policies, you'll want procedures, you'll want skills checklists. You will want to know, where do I go to figure things out? Where do I ask a question? How are things changing in this environment? Who do I need to talk to about how we handle COVID and masks, and my employees or my contractors, making for sure that they're immunized, or that, a lot of these assisted livings and skilled nursing facilities, they're not allowing nurses or therapists in unless they've been tested recently. So we talk about all this sort of thing. When you have an agency or a business model, it is not static. It's always changing. Where are you going to be resourced? If you've got your head just buried in the sand, How are you going to keep abreast of these new changes? So that's part of agency ownership, is being resourced. And I'll tell you something. When you start an agency, you're busy. You're wearing many, many hats. You may be on the license as the administrator and the director of nursing. And then you're also out seeing patients, and you're also out marketing at lunch, and you're also out taking the trash out and paying the bills and this sort of thing, interviews and training and all of that. You're going to be busy, busy, busy. You don't want to be like that forever. You want to create succinct policies and procedures and systems. So when you start making money, you can hire people, you know what you're looking for, you're plugging them in place. You're going to be able to go away on a vacation. You're going to be in Fiji, okay? And you're going to know that your agency is set up. People know what to do. They're trained. They know where to find things. They know, yeah, you've got systems in place. You can't just throw people into an environment and not give them systems. They will fail. They'll do it the way they think it should be done, and nothing bad about that. But you need to be driving your own bus. You need to have your purpose, your values, your mission, your charting, your checklist, here's where you find, say your marketer is out there and, oh my gosh, I ran out of brochures. Well, we create a brochure and it's up in a cloud somewhere, and she can get it printed while you're in Mexico. I mean, you need that we live in that kind of world now. Take advantage of it. So resources, resource. Stay open, surround yourself with people that are already doing it, create a tribe, and that's how you make it in this business. And number 10, I put mock survey here because this is what I do with my Blueprint to Success program to make for sure that your final product is good. But that is it, your final product, your touch point. What have you built now? This is the oversight of the entire agency. What have you built? Who have you created? What sort of teams do the actual touch point? What is that patient relationship, that relationship with your market, with your referral sources, with your employees? How clean is that? And we go through this with a mock survey. It's a remote survey. So say you are getting ready to be licensed, your state's getting ready to come out. I do a mock survey and I'll do it remotely, but we'll walk through your office. If you have an office, you'll share some charts, some HR charts of anyone that you've hired. We'll take a look at that and make for sure that it'll pass survey. We'll look at what documentation you have or that you have done, if that's all in line and if that's meeting guidelines. And then we'll look at some policies and procedures that a surveyor will want to look at. We do all of that, and that's part of my Blueprint to Success program. If you do get licensed or accredited, you will be getting surveys. I think California and Wyoming, and there's one other state that is allowing for like your accreditors to do the state licensing portion. Otherwise, the state will come out to do your survey. Some states, I know Texas, you do more of a registration thing. But there's different processes dependent upon where you live geographically. And like New Jersey, they will give you a state license, but it's temporary. It's for 1 year. They'll come out and do basic. Do you have an office? Do you have a locked file cabinet? Where's your HR? Where is your locked patient charting going to be? They'll ask you some questions. Make for sure you're not a scammer. but then within a year, you need to get accreditation. So you can start seeing patients right away, though, which is pretty awesome. That's really, really great. But you have 1 year to pass a survey. So if you go that route, definitely get a consultant. It's just a lot to do in 1 year. There's a big learning curve to this, but it's completely doable. And here I am. This is what I want to talk about. It's what I'm so excited about. This is what gets me up in the morning, keeps me up at night in a good way. So I used to be that consultant that did the one-on-one and worked with one client at a time. Like I said, COVID happened and I created this program, Blueprint for Success, how to start your own home care agency is one class or course. How to start your own private duty nursing is another course. How to do your own home infusion therapy services is another course. So I have those 3 courses. I have some other courses as well, marketing and more advanced courses, continuing ed courses that you get further down the road. But these are my courses and I'm super stoked about them. They are a 10-week program. And so each week we release you go online into teachable.com and you get your module for that week. That week you can put your logo, you can personalize it. It's very, very kind of clerical, where you're going and you're creating binders and you're setting up your systems, you're setting up your folders and your files. It's that kind of work. So you'll do that. And then weekly, we have a master class where you will listen to myself and some others, but mostly me. And I'm going to walk you through those 10 modules we just went through. I'm going to walk you through conceptually all of that so you understand it. That is recorded and you're able to go back and take a listen to it. I know it is live with Q&A at the end. Hopefully you're able to make the live, but that always can't be done. Those classes are minimum 1 hour. Some people hang on. Sometimes we go a couple of hours on those, depending on the questions and things like that. So you've got the modules that you go in, you personalize, you've got that weekly master class. And then I also give you a consulting, and that's a one-on-one consulting. I ask people to wait until we at least get close to the 3rd week or the marketing portion, because by then we've really talked about, you've got some of the language for business planning and for legal entity. And then now we're starting to talk about marketing. This is really when I love to talk to people, because they already have some things under their belt. They already have some ideas of the direction they want their business to go into. And I do a one-on-one consult and we talk about, I just ask you, what do you love? What do you want to do? What do you want that to look like? And what is we talk about your background. And 9 times out of 10, people won't realize how awesome they are or some skill that they have. Maybe it might be some odd thing. They used to be a hairdresser and they kind of love that vanity piece of something. We go way, way back. We find out some people love hospitality. Some people love beauty. Some people love design. Some people love tech. And you can incorporate all of that kind of stuff into your business and create a business that shines, that is different, that sets you apart. So we do the online masterclass, the consulting, and that mock survey, which is amazing. I give you tons of resources. I just threw a couple up here, but you can see I've got a patient handbook. This is something that I've created that's very, very nice. You'll put your logo on there and personalize it for your agency. I have done an employee handbook that goes over all the things that are expected of your employees. Again, This is personalized for your agency, but it hits on all the things that employment development department and civil rights, all of those sort of things are incorporated. HIPAA is incorporated into patient handbook, mission statement, values, all that sort of stuff that is required by your state or your accrediting agency is in that patient handbook, in that employee handbook. Here is a assessment skills checklist for an RN. I have those for your CNA or home health aide or home care. I've just got a ton of resource that is created generically for you to personalize. So 5-step process. If you want to get going with me, you need to enroll in the Home Health Academy. So you go to homehealthacademy.teachable.com. You will go in there and you'll choose, do you want to do home care? Do you want to do a private duty nursing? Do you want to do home infusion therapy services? Or do you want to do more than one of those? You can enroll for more than one. They go back to back. We don't do them all at the same time. It would be a back-to-back thing. So we wouldn't pile on you like that. So go enroll, homehealthacademy.teachable.com. If you still have some questions, that's fine. You can get a hold of me at pamthenurse.com, and we can do a discovery call where you can tell me, this is who I am, this is what I'm doing, this is what I want to do, this is where I live, here's my state, what do you think? And, I love doing those discovery calls. So you can email me at pamthenurse.com if you have more questions, or you can go to homehealthacademy.teachable.com and enroll. And we will be going next week. Next Thursday, we start on the 27th. We're going to get started, and we're going to start our weekly master class. We'll go into about the 3rd week, and you'll start scheduling your one-on-one consultation. I'll get you started on the Facebook group where anybody that is enrolled can go on there, ask questions. This is also where I will be posting the recorded master classes. If you miss them, you can always go back there and take a look as many times as you want. And after you get through all of this and you're waiting for your accreditation or your licensing, you'll schedule your mock survey with me. So that is the process in a nutshell. So all of that, how much would that be worth to you? It's a lot. It's my entire home health career curated for your personalization and for you to learn. I'm sharing all this with you. How much is that worth to you? You get it all for just $2,500. I mean, that's an insanely good price. I built it like, how would I want, if I was starting, what would I need to start? What do I wish my younger self would have known? And that is built into this course for $2,500. So super amazing deal. And $2,500 for a single course. If you want to do 2 courses, it's $4,000 for the bundle. So you get $1,000 off if you purchase both. If you don't have the simoleons right now, you can break it down into a monthly payment. So when you go to Home Health Academy at homehealthacademy.teachable.com, you can opt for that 2 payment option. So just know that that is there. And there's a limited amount of people that I take in. So don't delay, register right away. And remember, if you have any questions, you want a discovery call, reach out to me, Pam at pamthenurse.com. You can also take a look at my website, northstarmedicalconsulting.com, and it explains a lot about who I am, our agency, what we do. It explains a lot about our programs. So yeah, go take a look. So I really want you to consider, what do you want? Do you want structure? Do you want process? Do you want mentorship? Do you want this kind of wisdom, or do you want to wing it? And it's okay to wing it if you feel like you are well resourced and you have perspective and you understand the concept of all those facets of agency ownership. It's kind of up to you. And then look at those different models. Do you want to do a franchise? Do you want to invest in a franchise? Do you want to do a membership? Do you feel like you know enough, but I want a tribe? I want to surround myself with some sort of membership. Or do you want a consultant? Remember, I gave you some prices of consultants. Check them out. Remember me and look at the costs. I mean, this is a fraction of what you will pay. So wing it or those other options. Again, you can purchase my product at homehealthacademy.teachable.com. I've said that like many, many times, but hit me up, Pam at pamthenurse.com. If you want a free discovery call, or if you just have some questions, I'd love to talk to you. Again, thank you for all you do. I know this has not been an easy time in healthcare. So thanks for your service. And I appreciate each and every one of you. Thanks and be blessed.